I think more and more people are going abroad for surgery, especially since lockdown. I think the waiting lists in the NHS have contributed to that, but also I think that people are attracted by low-cost surgery. Cosmetic surgery may appear cheaper than having surgery in the UK, but you have to weigh against that potential increased risk of complications and time off work after surgery when you come home, and the potential financial implications of that. But also I think that if you do have to have private treatment in the UK following that sort of surgery, then you have to fund that yourself. And certainly some NHS trusts in England, I know, are billing patients for remedial procedures after they've travelled for cosmetic surgery tourism abroad. The majority of patients that we tend to see in the NHS with complications are from countries such as Turkey and from Eastern Europe. They travel for all sorts of surgery, facial aesthetic surgery such as facelifts, but also breast surgery and body contouring such as abdominoplasty, thigh lifts and so on. There are many risks in going abroad for surgery. First of all, they may not be familiar with the qualifications of the surgeon involved or the reputation of the clinic. All hospitals in the UK are regulated by the Healthcare Commission. There are specific risks in the perioperative period, particularly clots on the legs, clots on the lungs. A long flight can precipitate clots in the legs, as can an operation. So the two combined can increase that risk. You should try and minimise air travel, if possible, around an operation. I've seen a wide range of complications for people who've had surgery abroad, from, for example, facial aesthetic procedures such as brow lifts, where the patient has had necrosis of the skin of the forehead, which is pretty disastrous, all sorts of breast surgery complications. I've seen patients who've had abdominoplasty, whose abdominal wall is necrosed and requires skin grafts. And I've seen patients admitted with severe sepsis. So there's a whole range of complications that we see. There is a backlash because inevitably, because the clinics and the hospitals are so far away, the NHS has to pick up the pieces because that's what it does. That takes resources away from people that require treatment urgently within the NHS with other conditions. I would ask them to consider it very carefully. Cosmetic surgery in the UK is more expensive because of the hospital standards that are probably higher, and also the surgical indemnity is higher for the surgeons, which means that covers them for any potential complications that may happen after surgery. And you need to think, do I really want to place my life in the hands of somebody so far away, and what will I do if something does go wrong?